Hello guys, welcome on my YouTube channel. Today I will describe the nursing care plan of patient with suicidal ideation. This is very important question. First, you have to make nursing care plan, that is start with some important steps as nursing diagnosis, goals, planning, implementation, evaluation. So first point is self-directed injury. The nurse's goal is to prevent the patient from self-injury. That means the nurse's main focus to save the patient from self-injury. The planning to protect the patient from self-injury by removing sharp articles from ward, any injurious articles like knife, etc. So main motive is to protect the patient's health by removing all the sharp particles that are dangerous. So this is very important because this is very injurious to health. So implementation, how to imply? To provide a comfortable environment, allow relatives to stay with patient, never leave the patient alone. Administer antidepressants. Observe, record, and report side effects. Enter in all records that patient has suicidal ideation. That means the nurse should provide comfortable environment. Relatives should be with the patient during nursing procedure and give drugs as prescribed by physician. Record all the reports and side effects of the medicines. Enter in all records that patient has suicidal ideation. That means to identify the patient has some suicidal ideation. Evaluation, depression and suicidal ideas decrease. That means with all these steps, the evaluation is depression and suicidal ideas has overcome. So let's on second point, disturbed sleep pattern. The nursing goal is to maintain or improve the sleep pattern. How to maintain? To maintain calm and quiet environment with dim light. The light should not be very high. To provide clean and comfortable bed. To administer sedatives as ordered, because this is very important to induce sleep. Now, how to imply? Ensure adequate observant staffing in the ward. Help him to identify his what. Encourage him to maintain personal hygiene. Prescribed sedative drugs are administered. So, sleep pattern is improved. With this step, the patient's sleep pattern has been improved or has been improving. So this is very important because without a good sleep a patient can never be very well. So this is very necessary. So the main nursing goal is to maintain disturbed sleep pattern. So now move on third point, that is impaired communication. The main goal is to improve the communication. How to plan? To help the patient to communicate with others, to help the patient to express his or her feelings, to help patient improve self-concept, identify his strength, and help him or her to interact with others. That means some patients are not communicating with others. So this is the first step to help the patient to start communication with others, and to help the patient to express his or her feeling, what he or she wants, she or she wants to do, to help patient improve self-concept, identify his strength, and help him her to interact with others. That means the nurses should always respect the feelings of the patient, how they are. So they should respect and they should also accept how they are and what they are. So how to imply? First is comfortable bed making is done, and encourage the patient to talk and listen patiently, keeping up to appointments. Encourage his participation in group activities, socializing from smaller to larger groups. That means the nurse should encourage the patient to talk and listen patiently, keeping up to appointments. That means uh, the nurse should encourage the patient to talk with others and express his or her feelings and encourage his participation in group activities. That means the patient should never be very alone, and he or she should be encouraged to participate in the group activities, whatever it is, socializing from smaller to larger groups. So now, with all this, the communication can be improved, or communication definitely has improved. So now let's move on fourth point, that is low self-esteem. So the nurse's goal is to increase or improve the self-esteem. This is very necessary to cure the patient, to help the patient to talk with others, to encourage the patient know his or her strength and self-esteem, because during these situations the patients always feel low esteem in their self. They're not encouraged, and they always feel very low in their nature. So this is not a good to cure the patient. So this is the main goal. So how to improve? It will help to improving the attitude and socialization. It will increase the confidence of the patient. Same, it will help to improving the attitude and socialization. That means the patient's beliefs and ideas can be changed, because when he or she enter in social activities, that means he or she can express his or her feelings properly. So this will increase the confidence. It will increase the confidence, because when he or she wants to speak in front of others, that means he or she feeling confidence in their self. So with this the self-esteem can be improved. So let's talk about altered nutrition. This is very important. The nurse should focus on nutritional values, nutritional requirements of the patient. So this is very important to improve the food intake of the patient. How to imply? To help to maintain weight and physical health. Proper balanced diet and nutritional intake, that is help to recover the patient from the present situation. So it will maintain the weight and physical health of the patient. How to imply? It will help in maintain the physical health. Regular food intake will help in good health, because if he or she take good food and balanced diet, that means definitely the health of patient can be covered. So the evaluation is altered nutrition may be improved. With all this, the patient's nutrition level can be changed, because the body's requirement should be fulfilled by a very planned meal program. Now let's talk about last point, that is impaired interest. So the nurse's goal is to improve the impaired interest. How to? This is very simple. To enable the patient to take adequate food, develop regular bowel habits, develop a regular sleep and food intake. You know, sleep is very important, because without sleep, the patient can never feel relaxed. And food is also very important for a good health. To divert the patient from physical symptoms, always divert the patient. To help patient to use time effectively, because the time can be very important to overcome the physical health of the patient. So always help the patient to use the time as group participation, talk with others, like this. So how to encourage patient to work on his area of interest, like gardening, reading books. For example, he or she is good at reading, that means he or she should provide some good books that can boost their confidence, and loneliness can be improved. Ignore his physical symptoms. Always the nurses should ignore his or her physical symptoms. That means that they should divert the mind of the patient from the illness. Encourage the patient to go to day room. That means encourage the patient to go to day room. So interest may be improved. With all this, the interest may be developed. That means the patient is reading books, the patient is playing with others, the patient is gardening. So this is very important. So this is a nursing care plan of patient with suicidal ideation. This will help in our daily life, and this is a very important question. If you have any question and query regarding nursing care plan with suicidal ideation, so leave a comment in comment box. Thank you. For more updates, subscribe my channel.